Hi guys, today we're going to talk about Retatrutide, which is very popular these days on the algorithm. Everybody seems to be talking about it. So I'll tell you a bit more about Retatrutide and some of my opinions on it, using a bit of the data and some studies that I've gleaned along the way. What is Retatrutide? Well, it's a once weekly injection. It's a triple agonist, meaning it works at three main receptors. And that's a GLP-1 receptor, the GIP receptor, and the glucagon receptor. It's important to note that this is not yet FDA approved as of the current date, and I'm recording this video on October 2025, so it remains in phase 3 trials. So let's talk about the first mechanism of action, which is GLP-1 receptor agonism. So what this does is it acts on the central aspects of appetite suppression in the hypothalamus, and by reducing hunger and slowing gastric emptying, you have a feeling of increased satiety and the fact that the feeling of just needing less food. So imagine if you've got more food in your stomach, you don't really want to put more food in there, or if you've got reduced hunger signals in the brain, you don't have those cravings or that appetite that might make you reach for food. The other receptor is the GIP receptor, and the way that Retatrutide works on this receptor is that it enhances glucose-dependent insulin secretion, and by doing this, it improves overall insulin sensitivity and helps in a way regulate blood sugars after you've eaten a meal. And the key word here is glucose-dependent. You might know certain drugs like sulfonylureas, like gliclazide, which work by enhancing glucose-independent insulin secretion. And these sulfonylureas, such as gliclazide, have an increased risk of hypoglycemia because of this glucose-independent insulin secretion. But in this case, it's glucose-dependent, so logically there'd be a low risk of hypoglycemia or low blood sugar. And the third and final, but not the least, is glucagon receptor agonism. So this means that it's involved in increasing metabolism, especially increasing how much energy we use, and the breakdown of fats. And this overall leads to reduction in the fat in the body, increase in metabolism, leading to greater effects. So let's find out, is it effective? Well, we all know it's effective. We've all heard everyone talk about it, but let's look at some evidence. So this is a study that I found, a big systematic review talking about the efficacy and safety of Retatrutide. From the initial search, 3 randomized control trials were included, encompassing a total of 878 patients, and we'll have a look at some of the inclusion criteria. The studies that were included met these following criteria. So patients were obese or overweight to be included in the study, with or without type 2 diabetes. They had the intervention of Retatrutide, and various dosage levels were assessed. The control group was placebo, and the outcomes were, of course, we've looked at some body weight percentage changes, hemoglobin A1C, so a statistically significant percentage reduction in body weight compared to placebo after just 36 weeks of treatment, with an overall mean difference of 14.3%. That's 14.33%. Reduction in BMI was also statistically significant, and after just 24 weeks of treatment, there was a mean difference of minus 5.38. Looking at waist circumference as well, which is becoming a parameter in studies, increasingly linked with metabolic syndrome and cardiovascular risk factors. After only 24 weeks of treatment, there was a mean difference of minus 10.51, and I believe that's centimeters. So another parameter looked at was insulin sensitivity. There was a statistically significant decrease in FPG, or fasting plasma glucose, compared to the placebo group after only 24 weeks of treatment. And the HbA1c was also showed a statistically significant decrease. And importantly, we also see that the systolic blood pressure was decreased more in the Retatrutide group compared to the placebo group, with a difference of almost 10 units, with a difference of almost 10 millimeters of mercury Diastolic pressure showed some changes as well, with about -4 millimeters of mercury. So let's have a look at how it compares to other GLP-1 medications. So there should be a P here. Well, what the results show is that it just gives you more weight loss with less time required. So a key phrase at the bottom of this study is, a key advantage is the high percentage of weight loss in a significantly shorter study duration of 24 weeks compared to the 68 weeks in the step 2 trial for semaglutide, which is another GLP-1 agonist, and 72 weeks in the trial for tirzepatide. And just looking more numerically, we can see that 63% of adult participants lost at least 15% at 36 weeks with retatrutide, whereas only 40% achieved this with 15 milligrams of tirzepatide in the SURPASS-2 study. So what this all points to is that retatrutide is a more powerful weight loss agent, and we've seen on the previous slides that this makes sense because it works on 3 different receptors, which is likely the reason for why it provides the best weight loss and body composition changes. So the important question to ask with any newer medication is it safe? The systematic review that we're looking at seems to vouch for its safety. The overall, as we can see here, the overall incidence of adverse events leading to discontinuation was relatively low, and the safety profile was generally favourable. And it seems like the most common side effects were gastrointestinal in nature. And I've just got a little table here that shows some of the how the doses correspond to the risk ratios of the following symptoms. So it seems that as we increase it, so this is in milligrams, as we increase the retatrutide dose from 4 milligrams to 12 milligrams, we can see that the relative risk of vomiting increases in an almost linear fashion. So retatrutide is especially popular in the fitness spheres. You just have to type it in on Google or YouTube, and you have loads of videos coming from bodybuilders talking about how it's helped them with their appetite, reducing their cravings, and helping them in the cutting phase of their bodybuilding cycle or their bodybuilding season. What are some of the potential uses I think retatrutide may be useful for if we have more data? Well, we've already seen that it can be really powerful for body recomposition, reducing waist size, reducing body weight and BMI. So I think it'll be very helpful for conditions like type 2 diabetes and metabolic syndrome, especially as we've seen it reduce HbA1c and fasting plasma glucose. Now I wonder if it'll be just as useful as semaglutide being the other GLP-1 agonist with evidence showing its favourable use in certain cardiovascular conditions. I also think the longevity spheres and the anti-aging spheres will take a liking to this medication, given its ability to reduce inflammation in the body. It's important to note that whilst many people do use it as a bodybuilding supplement, current studies mainly are in overweight and obese patients, with not so much data on the bodybuilding or gym-going cohort. I do think that these GLP-1 medicines will continue to reduce burden on healthcare systems, and we may see a reduction in people going for or opting for bariatric surgery and opting for more less invasive medical management with GLP-1 agonists. So in summary, retatrutide is a very powerful medicine which has triple agonist properties which likely give it the increased weight loss benefits when compared to its cousins of semaglutide and tirzepatide, themselves being solely GLP-1 agonists. It's shown great promise in weight loss as well as increasing insulin sensitivity, but despite its use in online spheres, we must remember it's an unapproved investigational drug. Thank you for watching, guys. If you like this video and you want to see more, give me a like and subscribe.